some doctors, some clinicians are trying to, we just spoke of chloroquine a while ago, to see chloroquine will actually arrest the growth of this virus inside your body. There is report that it happened when you tried it outside the body. That's what we call in vitro test, where it seems that if you try it outside in a laboratory, it seems to work. Now, whether it actually works inside the human body is yet to be proven. There are other doctors here in Nigeria. What we used was the drugs for HIV, which we used, antiretroviral drugs, which we used, and those drugs were used on this patient. But we also told you that by scientific observation so far, up to 80% of people who suffered from infection of COVID-19 do not get sick or get only mildly sick, which means they didn't even take any medicine at all, and they were well. So whether those antiretroviral drugs cure the patient or not is still a question mark. But you give because you want to try it, and a lot of learning comes from this kind of treatment. So if you have a very desperate case who look like they are getting clinically very unstable, you begin to try many other drugs, including antiretroviral drugs, and other countries, as you know, are trying to develop vaccine against it. But that will take quite a long time before it becomes a reality. Since news of the outbreak of COVID-19 came out in Wuhan, China, the Ministry of Health has been preparing, has been looking at the situation, studying the situation, looking at the spread of it to other countries, and looking at our own resources. And at that time, we requested for support from the federal government, and we got the support, financial support, and started preparing and procuring. We have bought some of the things that we're looking for. So the preparedness started long ago, but I always told you this is called the novel coronavirus. People didn't quite understand it very well. The behavior and the pattern of the illness is becoming clear with time, and all countries are adjusting to what they see and what the disease picture begins to look like. So we are doing the same. And many countries have been caught off guard in that even countries with very, very strong health systems have almost looked like they are facing collapse. We are focusing, and we are focused always on two things. Number one, containing the disease, and number two, preparing for it. Those are the things we have been doing so far, and also hoping that we do not get so many cases coming in. This is, as I said, an imported disease. It's not local.